Hey everyone, my name is Dr. Hector Martinez. I wanted to tell you a little bit about myself. I'm a chiropractor. I've been in practice for over 7 years now. One of the things that's different about us is that we really try to, and a lot of chiropractors talk about this, we try to really get to the root cause of your problems. Big thing that I often talk to my patients about is, let's try to find out your triggers. Sometimes I joke with my patients, sometimes, your triggers could be something you're doing at home. And I'll say, if I could follow you around every day, all day long, we'd be able to, figure out, okay, if you're doing this, change how you're doing this. If you're sitting on this surface of this couch, you want to change that as well. So we really work with the patients on determining that. And one of the things we also talk about is what tools can we give you to help incorporate outside of the office. So is that physical therapy exercises? Are we going to incorporate a special breathing exercise? One of the things that I like to use a lot with patients because they work very well are essential oils. So can we incorporate certain essential oils to help reduce stress, to help sleep? Because sometimes those two things can be a trigger for patients. Can we use the essential oils in the office to make the treatment a little more effective, like when you're coming in for your massage? If you can relax a little bit more, that's going to help the muscles relax a little better. That's going to help reduce some of the stress, and then that'll have an overall effect on your body's ability to heal. So we like to give people tools that they could use at home. A lot of times we talk about with patients is also mindset. Patients come in here with a certain perception about their health, about their wellness, about what they're doing outside of the office, about foods that they're eating. Oftentimes I find patients tell me, I exercise and I eat really healthy. It's not always as simple as that. So that's something that I often work with patients to kind of change. And sometimes we kind of talk to patients about things that they should remove from their diet as well. And that's also like a change in mindset, a change in perception, because oftentimes you think you're eating something healthy and it's not. Oftentimes patients are eating healthy things and they're not getting the correct amounts of maybe the nutrients. One of the things we also do is we also test in the office. We test for vitamin D and different other things because some of your symptoms may be because of a deficiency in vitamins. So then what we really try to do is really create a whole customized treatment plan that's very individualized, very specific to the patient, where we give you things obviously in the office, treatment in the office, give you tools outside of the office like we talked about. Try to help change a little bit some of your mindset. One of the things I talk a lot about with patients is trying to improve your internal and your external environment. So internal environment, again, that's mindset. Sometimes we could do certain things to help improve that as well. External environment, who are you associating with? They tell us that we are the equivalent of the 5 people that we're most close to. One of the things we do is, to help improve that is we have our workshops. So these workshops in the office are really for our patients to help create a community so that you guys have a place to come, you get to meet new people, and hopefully you get to learn something new about our health. So that's a little bit about me and a little bit about how we work and how we work with patients. So if you're interested in work with me, we do complimentary consultations where we sit down, we talk a little bit about what's going on with your health, really get clarity, around everything, give you some ideas to change some of that. And then a lot of people feel like, after they leave the session that they feel renewed because they learn information that they didn't know. And then from there we could decide and take the next steps and figure out if it's something you want to dive a little deeper with, coming in for a little bit more of a thorough examination and testing if needed. So that's a little bit about me. Hope you guys found that valuable. Again, if you're interested in working with me, please feel free to give us a call. I'll leave the number in the comments. We have 2 locations right now. Otherwise, you could always shoot me a Facebook message. I'll leave my email as well. Definitely, we're here to help. So thanks a lot, guys.